Hi, welcome back. I'm Dr. Carrie Elliott, and today we're going to talk about an issue that I see on a regular basis, and that's allergies. Lots and lots of pets come to me with allergy problems. So you're wondering, well, what is an allergy problem in a pet? Well, let's start with doggies. Doggies will present with allergies because they're licking or chewing their feet. They can have chronic ear infections as well as hair loss, chewing at their sides. That's one of the most common ways that I will see a dog present with allergies. They can also have intermittent bowel issues, so they'll have diarrhea on a regular basis, or they will have a very low tolerance for change in their diet. They eat one little piece of toast and they have some diarrhea. So having more than 2 or 3 bowel movements per day or inconsistent bowel movements can also be a sign of allergies. For kitty cats, my number one presentation for kitty cats with allergies is actually coughing. Cats will get allergic bronchitis or allergic feline asthma. So they will get constrictions in their bronchioles and have issues there. And that can be life-threatening, so it's very important if your kitty cat is coughing, please call your vet immediately so we can get your pet into a veterinary office and get evaluated. So let's go back to allergies. So what are pets allergic to? There's generally 3 categories that pets are going to be allergic to. One are external parasites. So those external parasites will include fleas and ticks and mosquitoes and lice and things like that. Those pets that are highly allergic to those, a single flea bite can make them super itchy for up to 2 weeks, all right? The other issue that pets are allergic to is food. Now, when we look at food allergies, we're going to break that down into 2 categories. You're going to have your protein allergies and you're going to have your kind of carbohydrates or grain allergies. 94% of your food allergies are going to be to the protein source. Only 4% of food allergies are going to be to the grain source. So a lot of these grain-free diets are more of a ploy for marketing. They're not necessarily based on scientific data. So when you're talking to your veterinarian about allergies, please go with an open mind and be willing to listen about different diet options, okay? And then the third thing that they can be allergic to are environmental allergens. So what does environmental allergens entail? That would entail things like blooming flowers, blooming trees, blooming grasses, all of those pollens that are outside. It can also include dander, so dander from people, dander from kitty cats, dander from dogs, dander from rabbits or things of that nature, as well as dust mites. So a lot of these things that are environmental allergens are going to be ubiquitous. They're found everywhere. So sometimes it's very hard to get rid of these allergens when we're dealing with allergies in pets. So what is the first thing that your veterinarian is going to do when they examine the pet is they're going to ask about external parasite prevention. So they're going to say, is your pet currently on a flea or tick preventative? And it's not because they're saying that your pet has a flea infestation or a tick infestation. They're just trying to eliminate some of those things that are easy to control. Flea allergies are something that is very simple to control with either a topical or an oral flea or tick medication. Where I work, we like to use some of the isoxazoline classes, so we use Revolution Plus in our kitty cats, as well as NexGard and Simparica in our canine patients. So those work really well. They last for a month. They are reapplied on a monthly basis. And so that's one thing that we do to eliminate that one particular type of allergy. Flea baths were an option used in the past, but a lot of those flea shampoos use chemicals called pyrethrins or permethrins. These are chemicals that do affect the fleas and the ticks and will kill them, but they are also harmful to the pet. They can cause liver problems as well as to the people. So we've really kind of gone away from using those flea baths or flea collars or flea powders, things like that, just for the safety of the people involved, especially if there's children in the household, and the pets as well. I have seen kitty cats that have been bathed in flea shampoo that are having seizures and things of that nature. So it is important to use a flea or tick preventative that is species specific for your pet. Also, for the right age of the pet. Some medications shouldn't be started until over 6 months of age or over 8 weeks of age, so just double check the packaging, double check with your veterinarian, and make sure that the product that you are using is being used in the appropriate manner. So then we move on to looking at how do we determine if it is an environmental allergen or a food allergy. So the first thing they're going to ask is, one, what are you feeding? And when your veterinarian asks you, what are you feeding your pet? They want to know everything that you're feeding your pet. So from the time they were puppies, were they on a grain-free diet or were they eating, puppy chow? Everything that they've been eating will really help the veterinarian to collect a complete diet history and help them to choose the best diet that will help to manage these allergies in the past. Notice I say manage because allergies are very hard to cure. The one thing that we can pretty much almost cure is the flea or the tick allergy, and that's with a preventative. And so when it just looks like it's a flea issue, often the pet will be chewing at its backside, very near its tail, along its back, and they'll have some hair loss there, maybe hair loss along the back legs and the tail base there. And that often is fleas, about 85% of the time. That is from fleas. So they will recommend a flea preventative then. That can be a cure. That's awesome. We love it when we can fix a pet and they feel better. In kitty cats, when they have a flea allergy, usually theirs will be what we call miliary dermatitis. They'll have widespread hair loss all along their sides and their belly, and little bitty scabs all over too. And that's very common for a kitty cat with flea allergy dermatitis. And so now I digress. Let's get back to how do we differentiate between diet and environmental, and then we get a thorough diet history. Often when it is diet related, then you will see kind of a chronic issue. So it's not seasonal. You're going to see constant ear infections. You're going to see constant chewing at the paws, constant chewing at the legs, and not worse in the spring and worse in the fall. That's more suggestive of a environmental allergen, particularly to pollens. All right. So if your pet is allergic to dust mites, it's probably going to be year-round because dust mites are here everywhere, especially if there's carpet in the house. Some pets are allergic to wool, so maybe you just got a new wool rug, and that's causing the pet to be allergic. So there are different things that we look for when we determine at the general practice level. The first thing we're going to talk about is a diet trial. There is no blood test that is 100% accurate for determining a food allergy. So when they talk about doing blood testing for food allergies, it's not going to be the most definitive test. So I do recommend doing a food trial. So what does a food trial entail? A food trial entails stopping all food except for a single protein and a single carbohydrate source. So you might be looking at a fish and potato diet, or you might be looking at a rabbit and sweet pea diet. What we're trying to do is find a protein that your pet's body has never seen before, so it can't react to it in a negative way, and a single carbohydrate that your pet's body has never seen before, so it can't react to it in a negative way. And we put them on that diet usually for 13 weeks. With the advent of some new anti-allergy medications, in particular the oral medication called Apoquel, that really helps to reduce the itchiness. So we've been able to reduce our food allergy trials to about 4 to 6 weeks. We start the pet on the Apoquel to help get the itchiness down while we're transitioning them onto the new diet. Once they're on that new diet, primarily for 2 weeks, then we stop the Apoquel and see how itchy they are. If their itch level has decreased, then we know that we have found a protein and a carbohydrate that can be very effective. All right. So what do I mean by itch level? Whenever I evaluate my patients, I like to ask the question on a scale of 1 to 10, how itchy are they? So a 1 is not itchy at all. Maybe when they get up in the morning, they kind of scratch behind their ear and then they go about their day. If a level 10 is they're chewing and itching so much that they're waking themselves up, keeping the owners up at night. So they're just miserable. They're not able to get any sleep. They're licking and chewing until the point where they're raw. And so that's a level 10. So my goal is to get them from that level 8 down to a level 3. Sometimes I'm never able to completely eliminate the itch, but I want to get it to a point where the pets are able to sleep at night, the owners are able to sleep at night, we have less of a smelly pet and things of that nature. So not only do allergies make them itchy, but once they've started licking and chewing on their body, they will get secondary infections, and that gives them that kind of sweet, stinky smell. So we talk about checking their skin for infections. Often there'll be a cytology done to check for bacterial infections. If there is bacteria present, often a course of antibiotics will be run if the skin looks as if it has little pustules and areas that are indicating for an overgrowth of infection. In addition, topical medications are extremely effective in promoting healthy skin. So we're talking about bathing, and the shampoos are filled with ceramides and different kind of replenishing products that help to rebuild the barrier of the skin and decrease the amount of infection present, both bacteria as well as malassezia. Malassezia is a common skin yeast found on dogs and cats as well. So these are things that will be done. When we're looking at ear infections secondary to allergies, we're talking about cleaning out those ears, breaking down all that debris that gets in the ears and getting those flushed out. Often with an ear infection, it's not going to have a lot of oral medication other than an anti-itch because there's not a large blood supply inside the ear. It's mostly cartilage. So most of the topical medications are what are going to be used to help control those ear infections secondary to the allergies. So if you're noticing that your pet is getting an ear infection, every March and every September, you might be looking at seasonal allergy issues. So how do we manage seasonal allergies? Seasonal allergies can be managed either by treating the clinical signs that they present with. So if they just get 2 ear infections a year and you're seeing your vet twice a year for ear infections and the rest of the year the pet is 100% okay, great. If you're seeing kind of ear infections here and then chewing on the paws and your pet is miserable 6 months out of the year and you want to do something to get this under control, you do have a couple options. At your general practice, they do have the ability to run blood tests to check for environmental allergens. So what that means is the blood is drawn and the laboratory is going to evaluate the blood for certain antibodies to different allergens in the air. Okay, so say I draw a blood sample on a pet that has some allergies that flare up in September, and we test for all the things that bloom in September as well as that bloom in March. But there aren't any antibodies for what blooms in March. It's only going to give me a positive for what's blooming that time of year because that's all that's being stimulated in the system of the pet. So doing the blood tests, you're going to get a majority of what they're allergic to, but you will miss a few things if they're not being stimulated by their immune system. I'm located out here in California, and our weather system in Southern California in particular, it changes on a regular basis. Sometimes we have rain, sometimes it's 5 or 6 years before we have rain. So what is blooming at different times of year is going to be a lot different. So sometimes these blood tests can give me false negatives, so to speak. So they really are allergic to something, but it's just not blooming, so their immune system hasn't been stimulated. So the most effective way to test for that is to send the pet to the dermatologist. The dermatologist is going to do a skin test, and what that means is they shave a little spot of fur and they poke them with, I believe it's 88 different allergens, and they see how their body reacts to those 88 different allergens. It's pretty sensitive. It tells them truly what they're allergic to. They're able to then make desensitization methods, and they have a couple methods. They have a spray that they can spray under the pet's tongue. That does need to be done daily. And what it does, it gives small doses of what they're allergic to every day to slowly desensitize or calm down their immune system's response. Another method is they can do injections, and those injections are usually once a week for so many months, and then after the pet begins to respond better, they increase the concentration and decrease the frequency, so maybe every 10 days or every 14 days, and that helps to calm the pet's immune system down so they're not as reactive, and that will decrease the amount of infections the pet's having on their skin as well as in their ears and how frequently they're chewing. So if you have any questions, please call your veterinarian, ask your veterinarian about different types of allergy testing. So remember, all pets should be on a flea or tick preventative monthly. This is going to greatly reduce their exposure to those ectoparasites that can cause a response and cause itchiness and hair loss and skin infections. If they have more than 3 bowel movements in a day and they have a sensitive gut, so they periodically vomit, or they get diarrhea very easily, and they have ear infections and maybe lick their paws, talk to your veterinarian about food allergy. Talk to your vet about diet trials and different types of diet trials. If your pet has what appears to be seasonal allergies, so ear infections in the springtime and ear infections in the late fall, talk to your vet about environmental allergens and possible testing that they have and they can offer. And those are, you're looking at kitty cats and dogs. When you have a kitty cat that's coughing, definitely get your pet to the vet. And then we're going to talk about x-rays. That's the way that they will diagnose particularly feline asthma. So they'll take some x-rays to look and see how thickened the bronchioles are. And if you have what we call train tracks and donuts, so the airways have little areas of lines, and if you look at it at end on, it'll look like a little donut or a little circle. That can be thickened bronchioles, and that's a indication of asthma. And so what your veterinarian is going to talk to you about is about inhalers. So they can do inhalers that are steroid inhalers on a daily basis, as well as albuterol inhalers for those high-risk areas. When you look at kitty cats, we do have the flea allergies. We also have food allergies and environmental allergies. The biggest environmental allergy that we have in kitty cats is litter. So if you've changed your kitty cat's litter recently and they have begun coughing, bring that up when you visit your vet. And they will go through the different areas that we can change and help to modify to help your pet's allergies calm down and not be as reactive. So if you have any questions, please leave them in the comments below. And I hope to have another video up soon on dental disease. Take care.